Okay. Okay, on a good afternoon, Akushe, on a cabo. My name Natimu John Fuller. I mean, the program host of the Bɔdi Bεttεh Gentri program. We are the organization of Greater Manchester and they bring and come to we. Today we do menopause. The ins and outs of menopause. All the things we need for know. Dr. MSI Kamara na will present for we today. Before we start, I will just introduce the team to a quick. Then after that, Dr. Kamara will start. The Equa City is an organization of Greater Manchester and they bring the program to we. And the people that they present to we on all them programs here, and salon people them, now we own people them, now community. We don't learn book but medicine and they bring them program here to we. Okay, and in the list, Dr. MSI Kamara, now they present to we today, Dr. Mohammed Kamara, in an emergency medicine consultant at Greater Manchester now. So now they present to we today. So I will see I'm a lot and I will hear from a lot. Okay. The next person, Miss Gugia to Kamara, when a mental health nurse and a health visitor. Something they can put in or can present to we regarding mental health and all of our subjects. Then so said in the panel, if we get any question we relating to that, it will come in and give your advice. Okay. The next person will get Mr. Abraham Sise when I qualified social worker and also a mental health advocate. I don't know what to make me tongue the tie today. Okay. Next person, Miss Fatima Kuroma. We not do it today, but normally I can talk to we about the type of food they will for eat, how for able to eat healthy food, and then we will live healthier. The next person we can get at the panel, Miss Aminata Jallo. In order at the beginning today, but if you don't phone me earlier, he say he will join me midway through. He own specialism pharmacist, a clinical pharmacist, and he talk to we them regarding medicine. Anything for do medication, who's kind of medication for take, how for take medication, how for look after medication. Now in Miss Aminata Jallo can normally talk to we but. Next person will get Miss Aitata Shaka, instead of a mental health nurse and a social worker. Instead we'll talk to we about anything regarding mental health, we'll be able to give you advice, okay, and guidance. Next person we can normally get Miss Fatmata Kamara. Well, Mrs. Fatmata Kamara when Dr. Kamara and wife, but today you know we'll get for day with you, unless maybe towards the end, maybe go join me, but I've not been getting the signal, say go deal with me today. And the last person on the list, me, like I said, my name is Timo John Fuller, I'm a business IT consultant. My role not to forgive medical advice. My role now for make sure say I provide the team with all the IT support where they need for the program be successful. We get other people them as well on waking day on the panel or waking present to we like Dr. Aziza Sise, when I present to we the last session, but not do it today. Maybe you could join me at some point. We also get Dr. Toure, who himself can deal with himself now, general practitioner, but not deal with now for a while because he get other thing the way they do, but he deal within the team still. So at some point we will see him just in case when I see him in the future, we will not be surprised. So if I'm with them, without further ado, I will let us say no more and Dr. Kamara present today and we'll not begin on later already. So I will hand over the session to Dr. Kamara. Take me through the session. Dear me family, then while they present, I go ask, say, let nobody know unmute himself. I will therefore mute everybody. So we allow Dr. Kamara let it present without disruption. When it done, everybody will get chance for ask questions. You can either ace your hand physically by doing this, or within the tool, you get something the way you can able press, we'll be able to ace your hand. And if I see you hand up, or I see that in the way you hand up, I will come to you and ask. Now, if I don't come to you quick, it don't mean I ignore you. It just means no, maybe I don't see you. But once I see you, I will come to you for the ask a question. Come on, if you're ready.
Hello.
So I'll stop with you. I will stop me on share.
Don't worry, we're just going to simply switch. We're doing a free check for everyone in the area.
Four.
Simply switch. So we're doing
Do you hear me?
Yes, sir. I hear you.
Right. Okay. Family, when I do also on a day, whether in the morning, afternoon, evening, or night, perhaps. When I do and thank you for joining me this program today. Before we go any further, I think the host, Mr. Fuller, don't mention one of the names that Fatima Kuroma. Do you allow remember them in prayers because you know well in the hospital as we talk. But you know, I just make a mention as well. Remember, I mean, with prayers. You know, this topic today we will talk about, as we know, a topic where we know by left for talk about that. You know, when we do this alone, we know the mama them, papa them, or even the family talk about the topic, not taboo topic. But when a taboo topic, now that make it more important because we do people in the suffer to the extent where they say if them be know how to deal with this thing, then clearly it will be less of a burden, less of a problem. And as they say, a problem shared is a problem halved. So if we talk about something and they know about it, clearly then go deal with them better because you prepare yourself for that. But this menopause, nothing they begin from day one where the mortal man born, especially the woman. What make I say mortal man because it affect not only the man them but the woman them as well. We boku no say man self they go through what they call menopause. Boku man no but the can talk and some man can say what? Well that's it. But clearly, not only that, but clearly it affect the whole family, including the man them and the woman them. So from day one with the person born, na journey the person they pan travel, they go patrol. And that patrol they begin from when them born he turn, begin creep, begin waka. Then before he marry, he turn, woman begin pull bobby, begin get the period. And then the period now they lead to development, he turn woman and get picking them, taking, born. And then from born, you go to the point where he says, you need to see this period again. And of course, you need to take in again and you need for born again. But of course, this journey, you know, a long journey, not to see where the beginning. So as I say, from day one, where the person born, they work toward this and to the end of it. You know. So when I don't tell them about that clearly, I don't have to understand what you they try to talk about today. We get for obviously when we talk about something, we need for know waiting at the meaning of that. If we talk about say menopause, we want to know waiting at the meaning. We want to know how they affect we, waiting at the symptom, then what you go feel. And then, of course, not only the fact which they feel, but we get particular people, particular group them, who will go for deal with as well. Then the third one, we see that LGBTQIA, like almost the alphabet. But anyway, it means then we people and we some Monday na woman, you want on man, some Monday na man, you want on woman, and then they in between them. And that means then if they go through this thing, believe it or not. And then, of course, if we talk about that, we need to know what they cause this big, I know we call it sick, na phenomenon, you know, na journey, what they cause them, how you go diagnose them, you know, how you go treat them if you don't diagnose them, and of course, how you go for help you, for make you able for make this journey, this difficulty a lot easier for carry through, and then we'll go summarize in the end what this thing there about. So as I said no more, the meaning, all my daily menopause. Now, obviously, we need for no say this na stage. Na way they go from one phase to another phase to the next one until you reach the final stage. So, not a sickness at all. This na stage work where they happen to everybody. As long as you're born, you get them over here, you get this womb, you must go through this. It's as simple as that. And the meaning, na two words and then combine. The mens, na Greek word, the pauses, na Greek word. So when you combine both, mens means month, pan Greek, and then pauses means pause. So when you combine all two, na the cessation, it means the stopping of the monthly period where woman they see. This nothing where no woman no able to avoid at all. It's unavoidable, just like how other things in our life we can't avoid, and like that. You know, but of course, people and they define this thing as the woman them, we medically, then they go through their last menstrual period, now that then take as menopause. Now this period can last up to 12 months, you know. So as I say, now this we need for no. I just talk now, this now, if you look at the 5 point them, we then point to you, yeah. The first one, between the ages of 40 and 58, every woman, we believe it or not, some woman the way they born, they not get womb. Some man don't know that. And then they not get womb. And some day we born, then they get the womb, but then they not get the ovary them. And without the ovary them, there's no way you go get for born picking. Now it's in that. So between the age of 40 and 58, every woman will get womb and ovary, will get for begin experience some changes. Some man you go begin straight away, some man you go begin a bit later. But definitely between 40 and 58, then changes and therefore don't begin happen. You know, and the definition is such that somebody where they go through the menopause, if for at least get 12 missed period them. So like for example, January to December or December to December, if that's the case, if you don't see period for 12 months, then definitely that then consider as menopause. All right. Now as I say, nothing when they begin 110 no more, nothing they go small, it come to, you know, in full stop, really. Obviously, number 4, as you see, the symptom then way then they go through, most of them, the common one them, then they sweat too much than that. So then you go lay down, you go see and they grab, say, the place too hot. Before 5 minutes no more, you put the fan on. Next thing you realize, before 10 minutes, you hot the fan, say it's too cold, begin cover with blanket. All that thing then they show you. So then they for sleep, they get difficulty for sleep. They up and down no more. You know, they get them bad dream, then this and that. And of course, you know, interested in Papa again, you know, not get nothing for do Papa. Papa go near and say, no problem. They go alapana, you cause problem for them, then go make plaba because the mood they change. And especially so somebody will be say, don't they suffer with anxiety problem already. We will not talk about anxiety. I think Ms. Kamara and Ms. Shaka will not talk about that. But obviously, this even worse when they go through that menopause. You know, the sleep problem, of course, we will not talk about Mr. Sise, we not talk to you about sleep problem nightmare. So now even worse when they go through that period. You know, so if any woman they between the ages of 40, I will talk about the one the way they come earlier. But any between the age of 40 and 58, if then they experience them problem and they don't know what's in the happen, then they need for talk to the doctor. We go help them. The GP now enroll that for do for help for then see go through smoother. Now I just make give you now a few statistics, you know, for let know, you know, the average age, as I say, in medicine or in science or anything we do in life, you get the average when at the one day way boku within at the middle, and you get the other way they under below average and the other way they above on top when at the above average. So normally between the age of 51, most of the human then now don't begin go through the change in their life. Definitely. 1 in every 100 women them in the UK will definitely begin experiencing, but then most of them, then the 100 women they talk about, 1 in every 100 can actually experience them a bit early at around 40. But mostly on average, now 51-year-old not in the experience. You know, as you see, 1.5 million women them, you know, now then they experience them on an annual basis. And amongst them, then they 80% of them, they must get some symptoms. Now the symptom them boku, you know, up to 34. Some man say even more. But you know, me say now all the symptoms then one woman will get. It will get some more, it will get some less, or it will get 1 or 2. But clearly, you must feel 1 or 2 things there. And as I say, the symptom there, as you see them, we don't talk about that. The sweat in the neck, the feel hot and cold, you know, mood swing them, the joint then they add, the muscle then they add. And some women then they can get headache. Well, one day they not do headache, you know. Then they say, nothing will go for 2. The other one, obviously, as we need for know, as I say, usually the menopause can take up to 4 years. So after the last period, it can take up to 4 years for establishing and for carry on to the end. But some people, as I say no more, then the way they're above average, 10% of the human, the way they go through the menopause, sometimes their own time, it can last up to 12 years. You know, we hope say nobody not go through that problem for 12 years, you know. But I need to know about that. So as it is, when you talk about the menopause, you must want to know what kind of complication the way you will get with the menopause. Now, luckily for women, then because they get this monthly period they go through where they circulate and go, definitely their own chances of getting problem with their heart and then blood vessels that are broken in their body is far less until they get to menopause. When they get to menopause, then they're equal to demanding. Now we demanding, now we can suffer at an earlier age. But by the time they get to menopause, they're equal or even sometimes then they're higher than we. Apart from that, you go see say the bone then they broke. So Boku man can then lost balance and then go for them, and if then for them, then can broke the bone. So when they can come to we, if woman at the age of 51, 60, come a broken hip, clearly I can take and say now menopause the bone in the week. Therefore, sometimes if I say it's not normal for black broke the bone, then clearly I need for begin think about doing a bone density scan for see how the bone then there. And sometimes you go need vitamin D or you go need something for help with the bone. You know, the other thing making happen is that there is this risk. They go up with the possibility of ovarian cancer and sometimes even breast cancer. That now mainly and more so for people the way they use that hormone replacement therapy. So if, for example, you're young and then you begin to experience the menopause, and clearly, you know, hormone they put against nature. So they fight against nature, and therefore nature gets way the effect back. And so then they, if you take them for too long, that make nowadays before them they give you Panam, then go tell you, then go ask you age, and then go ask you how long you go for the Panam, then go tell you all. So that they go avoid, say, although then they give you the hormone for let they help you for the bone them, for the heart, and for the depression, and for the focus, and diabetes, and the sleep disturbances, then go actually say, well, we're going to give you up to maybe at the age of 45 or 50. And then thereafter, we will take you off because waiting do the risk of breast cancer, ovarian cancer higher. Therefore, we don't want for the help you with this, but then you will cause problem with you sick, you know, give you possibility for get cancer. So clearly, nothing when I go for negotiate with the GP. But as you can see, the sleep disturbances we talk about them, is surprisingly, women the way been done, they take in, they picking them big for the size, then develop diabetes when they get Belair way than they expect the baby. At some point in, you know, at that menopause days, sometimes the diabetes can come back. So that's very important for keep an eye on and see how the sugar they creep up. You know, again, depression, you know, because this thing that where you picking and don't laugh, human sometimes the one that say, I go born again and everybody get this, that thing, so can get them more depressed, you know, and get more anxious. And then of course, if you've been the focus for maybe 1-2 hours, you find out, say, you need to focus again for that time because before you might, the brain no as active again, it begin get confused, then clearly enough for begin think about them. So we just talk about then, you know, the complication that we see. Osteoporosis, not to do with the bone then, as I said, they're weaker. Therefore, you go need vitamin D, and you go probably go directly for eat a calcium rich, you know, diet. The food that they rich in calcium, like yogurt, you know, then the leaf the wood they eat, all anything they need and good for that. Failing that, they will give a supplement for help you for protect the bone. Again, the heart condition them, you know, the estrogen, that are the two hormones that are the estrogen and progesterone, and then two down the way woman they produce, whereas the man and they produce testosterone, you know. So when they begin go down, obviously, you will get more possibility for get heart trouble or problem, you know. And then of course, we don't talk about breast cancer. Not to say the breast cancer 9 day cause, and not to say the menopause 9 day cause the breast cancer. I want to understand that, you know. But the hormonal changes where they take place because of the menopause 9 day increase the risk of a breast cancer. I repeat, the menopause not the cause breast cancer, but the hormonal changes, the changes of the hormone where they go down, the estrogen and progesterone, now then they increase the risk for the possibility of breast cancer. Right? As I talk about this, na journey, na transition. You know, they come out from one level, go to the other level, you know. So man, so woman can take and say, this one, they don't know. I'm not going to go through that monthly period where I go to say, the back they at me, the mood they change, me belly they at me, you know, I they bleed beaucoup or they bleed less, you know, or sometimes they feel say, oh, I can't begin to take belly or this and that. Well, so man can take and say, now time for liberation. So man now, obviously could take and say, you know, begin get depressed because what you do by then they begin to big, then they begin left home. That's what they call empty nest syndrome. It's very important for look after. So if mama they go through it and the papa self understand, picking themselves understand, well clearly then go deal with them better, and the experience will be less challenging and less problematic for everybody in the family. But as we know, it begin between the ages of 40 and 58, you know, and the average now 51. But it can happen before time, when we call either early menopause or premature menopause. We could talk about that as we go on. But then, if you look at the causes, well, then get two. One way we say they happen naturally, we'll just talk about, you know, and then of course the one way they happen because of intervention, where something happen. So Monday he needs surgery because we didn't do something, and find out say he get abnormal cells. Then wouldn't they do that? When they do the smear test, they find out say get abnormal test, then they begin saying now for do surgery if they need for save the person so that I not going to develop cancer. So then go pull the womb then. And if they pull the womb, so most of the time then go left the ovary then, because when you know the ovary 9 they make you get this cycle, this estrogen and progesterone in the egg them. So if they pull all of that, then pull the womb together with the ovary them, then clearly this menopause go begin a lot earlier, a lot sooner. I don't see somebody who at the age of 27, he be not born 2 pikin that tender. If you really want for born more pikin, but because of the problem we've been go through, the bleeding be so bad, they don't try everything for make this thing better outside. So in the end, before it can become anemic, it can become passing weight until you get heart problem, heart failure and all that. Then they say, well, you don't born, you picking them. So we need for just do one thing and for try to get this over. And in the end, then pull the ovaries, they pull the womb, they left the ovaries them. So when you okay. But then the other one, he now end up lose everything. So in the end, they're going to give him hormone replacement therapy. You see? But of course, this one I then call early menopause because we didn't do something they cause that. Well, these other women, while you talk about we actually them pull the ovary and the womb them, they actually give them the option, say, before we take them, so until you go on born, they say, yes, but if you not get womb, you not get ovary, how you go born? And they say, well, okay, the option we will get, we will give you a chance to make you egg them from the ovary and freeze them so that you go either use surrogacy, where somebody say go rent you in womb, where then go use your own egg them with the man where you get for married for let them try and get picking for you, or that's it. Then go make the picking, then take the man where you get married in your own discharge, and you the woman egg, then put together, then make the picking begin for growth, then go then put up and deposit way in womb with the rent, we then call surrogacy, And apart from that, then you actually use that maybe to your fumble. We go for you womb where you will forget you egg when night. You don't pick in sex yourself. So then they get benefits and then get this, then they get balances there. Because now expensive thing them. So not all my for do. But the natural one, we don't talk that already say 9 days. So as I say no more, now the stages then what we talk about. We get perimenopause, we get menopause in self, and we get postmenopause. Now peri, now the one way, now the year then we surround. Like for example, by the time you did 35, 38, 39, now the peri one, then by the time you get to 40 and 45 to 50, that's it, now menopause itself, then the intramenopause, and then the post-menopause now after the whole thing got established. As you can see no more, the perimenopause can last, up to 6 years or even longer, and the menopause itself, obviously, can last, as we know, for up to 12 years, but generally by 8 years, if it don't be okay. So 12 straight months where the person, woman not seeing period, yeah, definitely they're in the menopause. As you see, the perimenopause can happen usually around the 40s, so around them 45, 46, the woman don't begin to say, the period not the flow, like I mean the flow, don't they last, don't they light and all that, and then continue. So definitely the estrogen level, yeah, then don't they dip slowly but surely, gradually, and then go up and then count down, go up and count down. So the period they're not regular again. So you can begin to see that, by the time you get to the 50, and get to 51, 52 clearly, then don't drop significantly to the extent now, they see again. But if you don't do 12 straight months, 12 months continuously, you don't see a period, then clearly take and say now, you in at the menopause. And then of course, when that don't begin now, don't happen, the postmenopause don't happen. Clearly, then go begin drop a lot faster until you get to the point where you say, now that you take and say, yes, now so it don't be for you. So that's it. So perimenopause, menopause, and postmenopause. Now, I want for advice we sister them, we auntie them, we mama them. If this menopause don't happen already, like I would put on, so at the age of 50, 52, up to 58, sometimes up to 60, if the woman begins see period again, not a good sign. So postmenopausal bleeding, not a dangerous sign. So if anybody they go through, and please, and pretty please, contact the GP or make them begin check you straight away. They go send you to gynecologist, then go check you, assess you, and find out why this will happen. Because once you don't stop, you need to come back again. But then we just mentioned that's what they call premature menopause. Now, obviously, as I say, it can happen to any woman, but we in particular, the Afro-Caribbean people, them now we prone to this. I get one my colleague where we did look into this thing to find out why it is that we as African people, then we get this subfertility where we need to take belly easily. And of course, by the time you get to 35, 40, you will begin left for C period. Why is that? What to make the other one, them, the counterpart, them, the which one, them. Then they're able to see that carry on. Why is that? And I think we're very interested in and you do research on that now. So anybody where they experience then can change here before the age of 45, Juya, a big one for see the doctor then, for make them able for assess una. And so until Nati will then go look at, they know say this one, Nati will get for do for you quick when, early enough, catch them, assess them, analyze them, and then obviously treat them where go forget you wish when you want for let you able for taking and born picking, because every woman in this world one for born picking and one for carry on or for let them call her mama. If that happened, if for call mama, then obviously to we place under Natabu, then go begin you all kind of name and that not to be nice at all, because clearly it cause problems with the psyche, the psychology, and the human in feeling and all that. Now making important if not we them for reverse, we them for cage and they're able for happy with them, then go do that, and the sooner they get them, the better it is for you. But you see, so the reason that they will go make some woman stop for get in period on a monthly basis, as I say, if it happened before 45 or 40, then clearly in premature menopause that. So until then we can cause them. Now, all man can go surprised, but tuberculosis, TB, nothing we can cause that. Malaria, now other one, nothing we can cause that. So chronic malaria can cause problem with menstruation, we can cause the human, no for born. So when we people learn for look at what to make we people learn, so then the human they know for taking all the things until now they overlook until you go don't get some bad malaria, or until you get TB where they don't know about. Not to just the chest, the TB they affect other side them all. They affect the gut, it affect the belly, and it affects the blood itself. So a lot of things can happen by then you see. And of course we get this thing called Turner syndrome. That's not the chromosome the way the baby they grow, then the self can cause that in there. Apart from that, then get this thing called autoimmune illness. Now, autoimmune means your body where you get the effect against you. So you get your body, all the parts the way you get, they all belong to them, but some parts there where they say, you not belong to this body, me and you will not get company, but then the body they say, no, we'll get company. So that effect there can cause one thing or the other. We go make to the point where we say, the human, they're not for conceive, and very early in their life, maybe at the age of 30. One example now, lupus. Lupus can cause that kind of thing, So clearly, TB, now other autoimmune as well, then can cause that. And of course, mumps. Now mumps, Bokuman fi say, now man no more the effect. Well, the human itself it affect them, because boy picking if you get mumps, and for try for clear as quickly as possible, because it can cause subfertility, where the picking, the bubble, for produce enough sperm for able to get woman for get pregnant. So these are all things we need to know about. The other thing that we can cause that, obviously, if they don't see you get abnormal cells there, na the private part, na the womb, then clearly they will get for do either they do operation with the support and then top them up with chemotherapy or radiotherapy. Now, obviously, if they give radiotherapy, clearly radiotherapy they send X-ray treatment to that area, and that area then I did the womb day, na did the tube then day, na did the ovary then day, and na did the egg then day. So clearly, it will kill them, and that can cause that menopause. The difference between the menopause where they happen naturally and the one where they happen because of sickness. Now, the fact say the one for the sickness they happen straight away. The moment you do the treatment, you're able to administer the treatment, and that's when you go begin to see the difference. But of course, when the natural one they happen gradually. They happen slowly but surely. You see, as I say, I've been not talking about the fact say. If you actually go through chemotherapy and radiotherapy and you're still able to produce the egg, then they can actually, as I say, we talk about the egg, then where them go freeze, and then later on you go forget picking out of that. But of course, you can go through counseling and therefore go to the risks them, and of course the possibility of heart disease and osteoporosis. So here you go. We don't talk about perimenopause. Now the symptoms then there are, you see, the hot flushes. Again, we talk about that. The problem for sleep, and the bleeding. Then they light, then they heavy. Some man can get clot to the extent they become anemic. If they turn, feel light, feel lightheaded, feel dizzy. Yeah, they turn and hit the turn, and then the heart begin beat fast. The heart they cut and all that thing. Then of course the problem with anxiety, irritability. Before you marry no more, small thing no more you don't vex. Still wait until you not be in the vex man. Don't begin vex. Pata picking, nakaya, cause and go under this and that. And it happened again to the man, cause him this, that, deny him this, all denting day, if they around that age between 35 to 40, he need for begin think about that. And if the man self no saying that they happen, then the picking himself no, clearly it will make it easier for cope and for take this thing through, because as I say, not to seek a journey. The brain again, the concentration can become less and less. So if you don't begin at the age of 35 to 40, do ya, let we able for beer. Then we mama them, we auntie them, we cousin them, and we sister them. We then they go through this thing. But the important for me, because if we don't know, we don't know how to deal with them, and that creates the problem. But now that when I done the bottom, sometimes we go help one person, we go forget for understand how this thing work, and then take it from there. We don't talk about the perimenopause, now we talk about the menopause there. As you can see no more, as when I see the symptom them and the changes them, look the picture. You will see, my way sometimes not be they get headache. I don't say they all been get migraine, or you get tension, headache, or get cluster headache, or you get headache because of blood pressure. But if a day come from nowhere, then begin come regularly at the age of 35, 40, 45, then clearly that's something a part of that. Look at this. So man don't even know about that. Say the gum then they recede, the gum then they get less, how you call them, poignant. We look at them, they're not for they look at them indeed, then they go down where they cause the teeth will begin show worse than I've been there naturally. And then they cause bleeding. So part of that, now part of the aging process, now part of the menopause. So day, the bobby can get less, the mommy can go down rather than a day up. Which until it's been the cack 10, 15 years ago, now you don't notice it, the baby don't begin go down. And of course, the nipple them, then can painful, The bone them, then can weak. Because of that, if them fall down, then can broke them bone nasty one, compared to how if them in the young age, go survive. Again, then mommy then when they get them big picking them, like for example, 10-pound baby, 8-pound baby. Sometimes we mama them they born 6, 7, 8, 10, and the labor maybe a bit delayed because they need for dilate in time, they can end up cause problems with the bladder. So that the extent then get this to them called stress incontinence, where before the thing can no more, where you feel for go toilet before you arrive, you can get accident. All the thing then because of the fact say the body they go through that change. So then they then can give you other treatment will go help you for that thing. If they don't notice them beforehand, they can treat you. Again, the place, the womb where the baby they lay down, in they get shorter. And because of that, the cycle then they get longer, and of course the private area, then they dry, then can cause problems where the skin they break, and then you get thrush, you get itching, they scratch like that. The more you scratch and the more you break down, and know the possibility say you will get infection. The skin they dry, where you can make, if you won't say for lay well, they take a lot longer than if you've been there in your young years. Again, we don't talk about catarrh. This palpitation, the heart, they beat fast. Then they all are part of the symptoms. And the big one, they can say, na man no more, and they get bullied. Well, the human themselves, when they go through the menopause, they can lose the hair. The hair, the thin, and it can become a bit of a problem where some women can get depressed because of that. The night sweat them, and of course, one main problem they can get now this weight gain. Then love handles where it can come and say middle age or crisis or whatever, and then they all can happen, and then they can make them depressed. They begin feel bad about themselves, say they don't feel attractive again to the power or and you wonder where they are around them. So clearly, and they help, and the business of mood swings them, the anxiety, all the things they help. So they all the things they intertwine and make it fine for making nobody's thing and know how we go for handle them. Again, as you see no more, it affects the mood, it affects the hair, it affects the bobby, the breast, it affects the heart, it affects the bladder, it affects the bone, and of course it affects the womb, and of course the skin. As we see no more, we don't talk about that. We get 34 symptoms I've been telling them first at the beginning. I'm not going to go through them, but if anybody interested for read about them, then they slide them bottom. When I go see them, we'll go for send them, and when the recording they go on, when I go see the slide clearly. But as you can see, we don't name most of them. I don't think we need to go through them, but you can see hot flushes, night sweats, the period them not be the same like them in the, they flow again regularly. Until you go see one today, see one for another 2-3 minutes. And then of course you get the mood swing them. JJ no more nine that you don't vex pantiwis until you not be the vex. The dryness, down below the private area. And of course the fact that you're not interested in, papa and and uncle and grandpa, clearly then they can cause problems. Headaches, anxiety, sleep problem, the loss of the hair, the memory, they the same, sharp as like I've been there. For concentrate don't become a problem. And of course the weight gain, weight naim bokuman they worry about. Then, of course, because you lose the blood, you get that dizzy spells and you can get tired easily. You know, the bobby I don't talk about them. It can become painful. The joint them. You can get bloatedness. You know, you can get bloating. So man can visit some term now intolerance to wheat or maybe bread. But this can be a sign of the fact that menopause don't come. You know, that bet at the hand, tingling, within at the hand, at the foot, it can happen. The skin, they become itchy. You know, they catch. You know, and of course, one thing where Mrs. Senobi know that the fact say the body odor they change again because of the estrogen. Now, if mama begin get an older way papa not used to, and clearly you need to understand say at this age where it is until at the age of 45, clearly important for you know say you need for support and this. Again, when that incontinence comes, that accident the way they happen, sometimes the human they feel say, oh boy, the urine will begin cause problem for a man and all that. Then they all they lead to the stress, they increase the stress, and the stress they lead to one thing, and then the mood they change from one thing to another. So most of the times on man can they need small dose or just a mild dose of antidepressant for help them for go through, you know, and then of course they can develop allergies to a lot of things that when they not be no say they get allergy to because the menopause don't reach, you know. So as we don't talk about all of this, you know, if you've been taking, you know, once every month or once every 6 months, now it don't go a bit further. Definitely menstruation no regular again. The fertility, the chances of actually taking in and conceiving less than I've been there maybe 10 years earlier, you know. And of course, the buildup of the fat around the belly, you know, now then they can cause problem as well. We now can make some women them prone to breast cancer, ovarian cancer, blood pressure, diabetes, all that in there, you know. So now we don't talk about the people and we know say now we on general day-to-day people, but there were a special group of people that now the one day we say then body, then visit then trap. Either a man a trap inside woman body or woman trap inside man body. So then can one go say then one go from one extreme to another extreme where then go the woman day getting ovaries them and everything. You go get operation for make them gear man private part, but then left the ovary. Now that kind of woman they clearly it will begin get the same problem that if they take the ovary out for let not get the symptom, it will get the menopause just like I been there as a woman. You know, same applies to the man. Instead of them begin you know, estrogen and just, you know, and progesterone, instead go begin feel the same thing. I get to the point where they say even for supposed to go through the menopause, clearly now that you go through as well. But it's important for make we know say we need for be tolerant, we need for understanding people there, you know, and for help them as best as possible, you know. And that's the essence of actually mentioning this for Leon. I know say people like that they exist, and we all know we they do them work here. We know say when they come across them, you know, every day almost, you know, they come across them. You know, last week I get 12-year-old Bobo we say one become a woman, you know, and that kind of thing can happen. So we just need to deal with that because this is the life, this is how it is, and we not get anywhere for go. When you get this the change, clearly you need to get treatment, and the treatment obviously they vary. But one point them way very, very important now the hormone, you know, that estrogen and progesterone, you know, where nine they go down to the extent where they say no go for make you get for begin taking or for begin produce the egg for that you so that you go for born picking or you know take picking in, because if you progesterone level no day up to 40, you not going to get pregnant. So then get for actually enhance that. Now, if you imagine say you don't get premature menopause or maybe early menopause, or they take the ovaries them away, then take the womb away, and now you're at the point where they say you don't begin suffer with the signs and symptoms, clearly then go help you with that. One of the ways for help you now for give this HRT, the hormone supplement them. Then get different one there. They can give you the cream where you go rub, they can give you the patches that where you go put in your body, where you go to change maybe once a week. You see? But you get to remember, say, I think the GP will actually take you through that, because any GP where they give you their medication, where they start you on their medication, will actually go through the contraindications and the risk factor there. Now, if you get family member, we get heart problem, we be not get clot them, you know, clot them at the lung or clot them at the foot and the leg, then, or maybe you get high cholesterol, then clearly that person they need and then you get forget possibly if you know say the family member get liver problem, And then if you don't get a stroke or if you don't get cancer of the breast, then clearly you can't be taking them patches there and then topical cream. The other treatment they can give the ring them. They call them then ring for pessary. Pessary rings where they put up the private pattern for the human for help with the dryness and the itching and the cracking of the skin. You know, you can go over the counter, you meet any pharmacist, you go actually suggest some gel them and some product that will go help with the dryness, you know. And then of course they can give you the low dose contraceptive pill for help you with the hot flush there, you know, and again for change the mood and of course the dryness. Then of course, this is not the big one. The low dose antidepressant, very important, not only to people in way get depression, but to people in way as well not get them. Because at the end of the day, you get to the point where sometimes you probably might need them. And what you want to do, and for try for catch them in time before you actually take control of you. You know, as you can see no more, we don't talk about all entire hormone therapy, the lubricants and way for give, and way for rub down below and the body, the patches there. And of course, the antidepressant them. And if you smoke, this is big. If you smoke, you need for cut down on the smoking and if possible, completely stop the smoking. That is very important because in the help at all for this thing. And of course, some lifestyle changes them where you need for take on board. So amongst the lifestyle changes, yeah, you can see regular exercise. You don't necessarily mean say, pass, you go begin, you know, go to a gym every day, this and that. No, you can just walk around the block. It's fine. Learn for relax. Take then deep breathing exercises. It will help you, you know, very much. And the diet, obviously, plenty of fruits, vegetables, whole grains, then they help. As I say, stop the smoking. And if you drink, we'll try and avoid or limit the amount of alcohol we take. As we know, Ms. Jallo did not talk about this thing before. You know, the amount of alcohol we're allowed. For women, them, I think now 14 units. If you can reduce them, that's even better. For man, them, I think now 21 units. If you reduce them, that's even better. You definitely can get counseling, you know, if you go through anxiety, the changes, and of course you get problems with the man or the boyfriend, or as they say, or the husband or whoever. But clearly, if you go through that problem there, or the girlfriend for that matter, you know, then of course you need for actually seek counseling. You know, try for able to get some sleep. Of course, the thing that they will go for help you for let you sleep better. You know, and of course rest as much as you can. Now, because of the incontinence, that accident can happen way before you feel for go past water no more than that. You begin wet yourself and all that. Then get exercise the way they can prescribe for you. We go up for strengthen the muscle and they way in at the pelvic floor. You know, then they say quite good. Then call them Kegel exercises. You know, one other thing we know they do is that we need to talk to, we party them, we need to talk to with people them, with family them. We don't go through this thing. Then get a lot for teach we and we get a lot for actually learn from them. They can actually help you for make this transition, this journey really a lot less burdensome, a lot less problematic, you know. And of course, this one naturally can cause problem like us, you know. Mama no want, papa want, and then it bring friction, it bring confusion to the extent where we say, we know say some man can divorce for that. Sometimes some papa them can get pushed for go begin keep them small picking them and this and that. We themselves, the heart not there that good, the blood pressure don't they up, you don't know, the diabetes don't they, you don't know, and all that. Before you marry, they say stroke. Before you marry, they say heart attack. So it's very important for making we get ways and means for try for address this problem, so that at least the process, the pleasure way people they get between the man and woman, it can still continue with a bit of adjustment. No questions about that. If you're able, maybe volunteer in a hospital or in any other gathering. You know, join a club, wait until you go to learn book or go play bridge or whatever, you know, and of course get a new hobby, you know, something where you know been able to do, but you know, do them. And then they go help you until you're able for write, put your memoirs, put your feelings down and all that. Never know until you go for print them or publish them, that might be a good thing for you. No questions about that. As I say, look at the food stuff there. The hand way on top, and then they will kill for eat, where they advise you for eat more. And the one the way they don't, and then the way they advise you for try and avoid. As you can see, we will like McDonald's, then fast food and all that, then deep fried food, then you know, refined grains and all them things. Then they try for eat less of them. You know, if you go through this period, try for eat more of the sweet potatoes, the nuts, them green tea, vegetable fruits, you know, fish, yeah, turmeric, dark chocolate, you know, extra virgin olive oil. You know, the herbs them, and then of course garlic and ginger, you know. So in summary, all man for no say this thing that thing where every woman, as long as you get womb, you get ovary, you get for go through this journey, you get for go through this transition, definitely. So the changes in the relationship, na work and the home and all that, picking them then go, that emptiness syndrome can get a significant effect on the person, on the woman. This is not a problem for just the woman no more, a problem for the whole family, including picking them and papa. You know, it's very important for make we all gel together, make we get this thing going to the extent where we say the woman we are indirectly involved, he actually need to face the problem where he could face, it could make them a lot easier for carry through than for letting one green face them and they go through depression and then one thing lead to another, you know. But as I say, Bokuma then don't go through this, or man don't live in the 80s and the 90s. They live a very fulfilling life after this transition, this interval, you know. And so at this point, I thank you very much for listening to me. And as I say, this is not the one that way, if we want to read them in detail, then they are, you know. But thank you so much. And I go allow now for Mekuna able for them decide whose question they want to ask, and me will be happy for, you know, answer them as best I can. Thank you so much.
Thank you very, very much, Dr. Kamar. Thank you very much. That'll be a good session. I see all my face quiet. I wonder what people really think. Thank you very much for attending, and I thank you on all done patient. Now, at the time we go open the floor for let people ask questions. By the way, I see how people in concentration. I mean, watch people in their facial expression. You know, that's serious. Everybody think, and they look forward now to the questions. What are they go first? Before, hey, yes, brother Karim, how are you, sir? There you go. I don't unmute you, sir. Try for unmute yourself. Press unmute if we're able, allow you for unmute.
Yeah, okay.
There you go.
Thank you very much. Thanks for this enlightening, you know, presentation, Dr. Kamar. It's always beautiful for listening to you, where they broke things down for we level understand them, no sabi, like me the afraid medical terminologies and bad one. I get well, you don't quietly help me, Mr. The gentleman that I talked to now about the last presentation, when about diabetes.
Yeah, I will put the link.
Yeah, and I want to pray for so many of us, we want for country about things can happen, we'll get some burial so that things can prevent you from. I make up the ask for able to repeat that. But anyway, since you go on YouTube, then you go find.
Yes.
I know we're keeping along. One, there's a myth around, say, man can get menopause. I don't know if that's not just myth or not way factual. Now, I just want to let Dr. Kamar throw light on. And two, now, depressants, you talk about antidepressants. We as Black people are very, 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 you know, suspicious of depressants, tablets and down, and they would feel say, now, way down the way, in fact, would even feel to say, a ploy for let some people way not like Black man, just make let increase. Let me then they did and then antidepressant and they. I want to let you tell me small about that because it's important. You don't mention them but twice for sure it will help. And the food side, unfortunately I don't see this, I don't the slide and non go. But the food side, on some food then they were some man they feel to say they even cause more problem for them than it will help them. Like for example, yeah, some food then where they're not only allergic to not all food the way we talk about allergies, but now food and the way they create some discomfort, and then they can always mention. So how person will able to supplement them food, and then a nutritionist they will advise for them to talk to, or now just now your personal research you will go about because you're going to hospital and thing they tell you. And I don't know what I get for you for now, sir.
Okay, Dr. Kamar, I don't know if you catch all the question. And the first one is whether menopause affect man them. The second one about antidepressants, you know, waiting at the effectiveness of them because there's a myth within the Black community say if you see them give, they begin giving, you know, and do something cynical to we. And the third one, sorry, what's the third one again? Oh, about foods, the diet, we dietary stuff, basically, and which now your advice on that. Sorry, sir, we need you. That guy for mute you back. So now the three questions are in the Uncle Doctor. So if you can help me with what, please.
Now the African perspective, more like people where they aside the way they will get some of them food and they will them very costly. Now food and none in the way sometimes food in the way Africa will fumble them with it.
Yeah.
Because at the end of the day, we in a very small number now, and could call minorities. But we say black them boku and food scarcity. How possible we have square balance that one? Then I ask.
Oh yeah. If you go on the YouTube channel, you will meet we one party program. There were, I think 2 or 3 programs what we don't do on diet. He go there the way Fatima and I been doing. Me break and down. He give you advice on the type of foods that we'll be able to eat. How we able to eat a balanced diet based on we own food them we don't normally used to. But Uncle Doctor will give you an overview. But if you want like an in-depth information, I will share the link in a bit before we finish. I will share them. So you go able to go on YouTube and see all the other sessions that will be done do before.
Thank you.
So Uncle Doctor,
we shall information I give people them, briefly. Although now I'm glad they were on YouTube. Some of them here what they get from Dr. Kamara. Sometimes they also they pass it on to some of young people where they ask you the future so we will know better. But that make level be able too small more for them. Sometimes they don't foolish question what they ask a big.
It's okay, no question or they will foolish, I'm sure. Go ahead, Uncle.
Thank you so much, Brother Dabo. I'm so grateful for your comments there, and really thank you for joining us. You are one of them. They join me, and we grateful for your support and the enthusiasm way they show. Now, the first bit where you talk about the male menopause, so man, no, in fact, one slide the way, I know we just want confuse the matter, but I think we will put them up. Maybe you don't hear the phrase andropause. Sometimes you don't hear that shit. Andropause. That's not the male menopause. Believe you me, the symptoms that we women they go through very similar to the one that way the man they go through. But for the fact say the libido, I don't know if that makes sense to you. The libido in the man when they go through the andropause or the menopause or whatever you want to call them, is far enhanced, really high, to the point where we say this man all 10 want this thing, all 10 want this thing, and unfortunately the body now they tell you say, "Party blow, you get for reversal, take a reversal." You know what I mean? Yeah. So the body in adaptability and the head or mind in desire, they're not there in sync. I don't know if you follow me. I don't want to be very crude, but I want you to see which side they go. The supply, that's it. I don't use economic term, although being a doctor. The supply and the demand, they're not equal. And so we think for happen here, which side you they get the supply with the demand day, the supply, they come. So the next thing you realize, the demand does they go higher and higher. And because the supply no day for meet up with you the demand, then the man begin for go buy cookery outside. If you know what I mean, the drift. I see the laugh. I can make joke, Now this way they go outside for go get this, cookery. Where the cookery, the person way they cook the cookery, if you been they put one creature for you, and then a 5 you go put. You now want make chief bumper lie. Yeah? That is where the problem arises. I don't know if I'm making sense.
100%.
Absolutely.
I don't follow.
That is where the problem
And I'm
arises.
sure Mr. Dabo they follow. We see they laugh, so they follow.
Exactly. So the next thing you realize, chest pain. The next thing you realize, blood pressure picking up. Next thing you realize, heart attack. So stroke. All the things that way really important for me to look at. But if the supply and the demand actually get one way for each, even if not 100%, but maybe up to 50, 60, 70%, with the aid of some other thing. For example, if you take the antidepressant, the woman take the antidepressant, it will take up to 6 weeks. So when you begin to take the antidepressant, not to say they work straight away. Miss Kamara will tell you about this. It take up to 6 weeks to make it kick in. Then you begin to feel the effect. So imagine, if this thing don't kick in 6 weeks, clearly, so then that cookery will be enjoy outside, you're not going to enjoy again because what you do, now you don't begin eat fine now. You see what I mean? So that helps you. It balances it out. At the same time, the woman get more faith by you. At the same time, the family, they gel together. The unit to gel together. This is just psychologically, I just to tell you to make you see how things they work out. If anybody tell you, say, the antidepressant and they give them because they want for do something to me, well, clearly, I can guarantee you, I get 10 colleagues them, 10 people they work with. Out of them, 6 na senior doctor them, they're all day on antidepressant. And not to black man them. Yeah? So now common thing that I can guarantee you. So let anybody, just like how they did earlier on this morning, until you say, now South Africa, all the black man, they say, this now with Mexico, you know they catch black man. It's still they carry on. And now they go on to a second wave. It is amazing how, you know, we they actually be beyond punisher. You know, it's important for say, I tell you what, this is the way they make. It's clear. This is a real problem. You check this out. Andropause. It is so poorly understood. There's a paucity of the knowledge to the extent Bokuman, if they be know what they do. I mean, people them. Almost Papa they talk to people, don't you? They're not there. We remember themselves. That's not taboo subject. So therefore, they suffer in silence, and then the next thing you realize, one thing leads to another. I tell you what, suicide very high at this particular point. That way, I tell you, the people, mental health people, and will tell you about that. It's so high. But if you understand what they deal with, clearly a different story. And something, all it takes something for adjust the food, you know, adjust the environment. Take 1 or 2 things then for help, you know, for let the dryness get better, you know, the itching get better. You know what I mean? And of course, you know, you cope better. You know, maybe take another hobby. It cope better. Absolutely, you do things in a better way where you just go enjoy and say, I tell you what, why on earth this woman don't give me all in life? 20 years, 30 years, I don't want five picking them for me. Then pick it left. Now when me and him for enjoy yourself, no. Because of waiting nature they do to them, I've actually left and go. You know, it doesn't work like that. But clearly, if you know about this thing, you see say then don't they happen, you notice them from the human way, completely different from the human you sabi. Clearly, you self can take a lead as the man who help this woman for go through this transition as smoothly as possible. And with that support, I tell you what, it will be grateful to you and it will actually respect you more and like you more because it knows say you're not shown them at in time of need.
Thank you very much, Doctor.
With the food, clearly, if you're there Africa, there's a lot more you can supplement. The vitamin D, what we talk about, then get in Africa. We not get it. Yeah, we get 11 months of rain and snow and whatever. You know what I mean? Yeah, 1 month we get sunshine, you know? Yeah, that and get them. The food the way they eat and are completely different. Then they reach in all the things we talk about. We did there. They leave them. You know what I mean? All the things then they, you know, the canned fish the way they eat and all that. I mean, how much money would afford beef? So money they cry for make the person die like go eat beef 1 in 6 months. You know what I mean? So the fish get your role for play and all that things. And it's important for me to remember that. You know what I mean? I don't know if I don't answer your question there, but I'm happy for taking this out of here. All right.
Thank you very much, Uncle Doctor. For my friends, them way when I can say una trunk pass me, so una older pass me, so maybe I don't be reached as I did. I don't call name. Somebody there when in your name na just iPhone. Now you first be doing easy enough. Auntie we the vest. I will come to you in a bit to say honor 8X. I will come to you. Let's see I'll come to you later. You're not part of the panel. I'll come to you in a bit. But I don't know why you on. iPhone, you know, getting
yes.
You put your up.
Yes.
I don't try for you to. There you go. Yes.
Yes. My name is Hamida. I call from the US. My question is, I joined right probably in the middle of the whole conversation, but I believe Doc they talk about between ages earlier than the early stages of the menopause, then you say up to at least 40, 45, then a pre-menopause or early menopause. And then, so my question is, so actually the real menopause, well, what do they expect for start at 45, probably 45, 46? I just want to know that, like the age where medically the menopause they start. And then secondly, the second question is, during what if you don't want to take their hormone pills, because would they say during their hormone pills, then they for stabilize your hormones or bring them back to some way can get side effects. So what if you don't want to take them pills then they for the hormones? What's not the other alternative where you go take?
Thank you.
Question. Thank you.
Yes, Uncle. No, I hear you, Uncle. Go try for mute. There you
go. I just don't know now. Right. Thank you so much. Yeah. Thank you, sister, for joining me, from the US. We're really grateful for that. Now, obviously, as I talk, I don't know if you can see the slide. You know, it don't mean say now all man they take the estrogen and progesterone supplement, not to all man. So man they can cope without them, you know. But the one that we need them, then we'll definitely get to go through the risks versus the benefits. You get for sit down there definitely. I always tell people, if you know take part in this assessment, then clearly you know the do yourself any favor. As I put a number, if you get a family history of stroke, cancer, breast cancer, ovarian cancer, yeah, then in the day, clearly, then get for tell you about them, say this one, the risk they go up, blood clot and all that, you know, pulmonary embolism, all that in the day. Then get for tell you, say, if you get family member, we be not get them cancer care, well, you they at higher risk. Therefore, the GP or the primary physician, you know, we will not get in America, you know, he will definitely be in a better position for actually give you the alternatives there. So the moment you tell and say, wait, my mama, you don't get this, or my papa, you don't get this, and I take note, say, there are they from this risk category, therefore, what you will suggest? I'm sure they get ways and means of dealing with this. There's no questions about that. They get a lot of counseling. They will talk to you about diets. The dietitian will come in. The simple, you know, patches them where you go use, we go help you with that. You know what I mean? If you don't want to take them, clearly nobody no go force you for take them. That is guaranteed. There's no way anybody go for do for what you say for take this thing without your consent. Impossible. If I were people in the country in the hospital, I always tell them, say, before I go forward, I get 4 options for you. The 2 might not be possible, but I need to tell you legally saying a 4 option. One option we now we talk about is do nothing at all. Now you now get everybody. If you now of sane mind, you get capacity for make that decision there. There's no way anybody, any doctor, they in that position for force that in the clearly not. But there are alternatives where if you talk to your primary physician, they will tell you. And as I say, the age of the menopause, as it were, we get perimenopause, we get intramenopause, and we get postmenopause. Perimenopause, obviously, in the 40s, yeah? It can happen a bit earlier, you know, but you're at the age of 38, late 30s to early 40s, perimenopause. By 40 to 52, clearly menopause will not be setting. You know, it can take up to 4 years, as I say. Some money can take up to 12 years. So you need to be really sort of attentive to your body. You can begin to the changes. Nobody going to you yourself for yourself. Okay. The fact that the period that we've been get on a monthly basis begin go for 2-3 months, you don't get one. Yeah, or sometimes you've been to go 7 days where you get the period. Now all of a sudden you go for 2 days. At the age of 35, 38, you begin for things. Say, hang on, no, I don't get this close. You know what I mean? So clearly, by the time you hit 40, there's no two ways about it. This thing for don't begin up. You know, but one thing I can tell you is that anybody will get menopause too early or get menopause too late, clearly the people are there at a higher risk. I don't know if that makes sense.
Yes, definitely.
And I don't know if that answers your question, sister.
Uncle Doctor, I get another question now for you. Yes, so we can see you. Don't worry, they come. Don't worry, they come. The question is, if woman don't reach that phase day, then can still get pregnant? And if they get pregnant, how common is that?
Superb, beautiful question. Thank you so much for that question. I've been waiting when that question need to come. There's a big danger. You see, if the woman don't do something, the last speaking, you don't born picking don't hold 10, 15, and then the period then don't begin go a bit wonky, as I can say, up and down. Yeah. So say you see her this month, next month you don't see her. Next month after you see her light. Therein lies the danger, because now it become complacent. Say, I tell you what, there's no chance for me to get better. That is when then bad thing can happen. Like the ectopic then can happen. You understand? Then can miscarry, and they can end up really with complications, because between the picking the chromosomal defect that we then can get, like people can born with different things that, you know, where they can say na double, na this, na that, or na density that can happen. That make you see then say by the age of 30 going down, clearly there's an increase in the percentage of Down syndrome. You understand? As you go higher. So these are the things, and so clearly the possibility they distinctly say this woman can take belay. No. I don't know where I didn't know hospital then come and say this woman in belay the attack. Just can't check and for see, because we want to do X-ray of the belly. Where I go feel the belly, if you see the baby, 7-month-old baby. The baby like this is a 50-year-old woman. Now they tell me say the doctor will go meet and tell me, say, la left for each brain. Is it because I don't put on the pounds, you know, the belly don't big. Now I say, oh my God. I say, okay. I say, you're in labor. Now I say, we will not try to do nonsense. Which kind of labor? Now I say, well, you see the period. They say about 7 months ago. Now I say, oh, I'm sorry. With this, you're pregnant. And now you're there in early labor. But this is a 50-year-old. So it can happen in a distinct possibility. So you need to be very vigilant and very careful. Now, then day you pray against, because clearly you can go X-ray where you're not supposed to. And that picking they get right for can sue you up to the age of 18 years. It can still sue you. So that's a big problem. We can talk about that next month, but I tell you what, it's very distinct and impossible to get Wẹll at that period. In fact, it's very dangerous at that time if you're not careful. I don't know if that answered the question.
Yes, definitely. Another question is how long menopause can last for?
Yeah, we talk about that. As I say, on average, now 4 years, but above average, it can be up to 12 years. So at the age of, 50, 58, it's supposed to don't complete now. But if they get on to obviously 60 and all that, then perhaps it needs for further investigation.
Okay, thank you very much for that. The next person is Isibugi. I don't unmute you, man.
Thank you, Dr. Kamara, for this. I hope say plenty women and they from this program today for let them get the information. Not to just before say down the way in menopause already, but down the we not begin the menopause yet, because sometimes when you talk about the menopause, we all be dependent and thinking what you talk about, they understand until it happen, right? Dr. Kamara don't talk at all waiting the menopause is all about. But now one thing I want let people understand back for say, like way let people not think for say, oh, they say the menopause, the person don't old now in the old tick self now. They never about him because a lot of people even when Dr. Kamara they talk, the waiting there for me they get some here. It's like, so I just want to let people know for say no more now. Then people ought to go through the menopause because you're still young, right? You're still young, but it just that no more the term don't reach for when nature say this is the end of it. You understand? You're not go able for born picking again, you're not go for I wouldn't call them again. And what you talk about as well, where the man them or where the relationship they can well and the during menopause, when the menopause don't come. If we think about the people in Africa, not so they all know about the menopause. Truly, me I think now where I can answer because I know one day any of my family them talk about the menopause. Maybe certain people and they will go will know about them, but people them the only way they look back now, they remember for say, oh, maybe now that took me mama been the vex way the vex that kind of vex they so. Imagine you go through the menopause, you the sweat boku. That person they know they even know what's wrong with them. What make it the sweat that kind of sweat the way they sweat, so what make it they feel that way they. Now Africa now, where that person they keep quiet again and go say either na do them do am or now with human, it not be the witch today, but as you don't keep quiet no more. When if no even know what thing they happen to him body, they say now witch the witch. So it good for like that first gentleman that boy where you say where then they get the information also for pass them back to people. It good. It then a YouTube, the people then listen to them, watch them, and pass them on to people because now the only way that one day will go learn for say waiting that man they go through, then they go through a lot of phase, that depression, that sadness for say, oh my God, I'm not going for born picking again. Oh my God, now all are the also, oh my God. All them things then they go through that man they aid, So if fine for like we support the man self for understand. And I don't go blame the man them. I don't go ever blame them because they self don't know. They don't know what to make that man they behave that way they. So it's a lot of this education where this world now where we get for like to pass amount to people so that the man themselves, as Dr. Kamara don't say, for like they support the woman them, not for go back in the street for go get new woman because it just creates more problem for you if at all that way the man want for things. Let them work together, like Dr. Kamara say, yeah, that woman they don't deal with you for such a long time, all then you actually don't support you. If something happen where one day and deny you for anything, then something is wrong, for let them then deal with them so that life will go back on with the beginning itself, let all man be happy again, one harmony.
Thank you very much. At least you don't begin waiting for the appetite for your next session. We will be the next fortnight. Also, I believe say Uncle Doctor will come with the the other parts to this, we go more
Yes.
concerned with demand them, so demand them go understand. Yes, me I not reach that side,
Understand,
but at least it better not begin now. So why they get to that side, you know, if I begin become get nan, people will understand why. Okay. I go to Wianti where they in white. It say Honor 8X. You haven't been on there for a while. You picture the show white, like you wear white vest. You still ask your question, ma? I don't try for unmute you.
Ah, okay.
Yes, ma. Go ahead. Oh, okay, don't take them off. All right. Like what I said, yes, Auntie Hannah. Okay, I'll go unmute you. There you go, ma. Yeah, I don't unmute you. Try for unmute yourself now, your phone. Unmute yourself. There you go. There you go. How are you, ma? Thank you very much for joining me.
Good evening.
Hello, ma.
Yes, I'm so glad for this Zoom meeting here, for this program. You know, I learn a lot from waiting doctor don't talk about the menopause and, you know, the menopause itself and the after. You know, I can give an example because Ade, I'm in Somalia here with my colleagues, especially my Ghanaian friend. Sometimes they vex no more. They can don't ask something. They say, Madam Hannah, how do you feel about that? You know, Pastor I go meet her. I say, Madam Julie, why they behave so? They say, menopause. I say, oh. So today I get this discussion, this meeting here. I'm so glad you don't. Doctor, I'll get a question for ask. I get a message from Nigeria that a woman of 68 years, give birth to twins them. But because this woman, according to your explanation, you said sometimes the menopause, they come very early or they come late. But thinking of a woman of 68 years old giving birth, and the other parts of the question that I want to pose to you is that when a woman, we don't reach menopause, for instance, me as an example, I find out say my vagina is just like somebody we know sabi man business. I say I want to ask why. What is the reason towards that? Where you get that with your husband, your vagina is so tight, waiting at the cause. I thank Kuna all.
Thank you very much, ma. So, Uncle Doctor, now the word that the first one about the 68-year-old woman born twin in Nigeria, and the second one now the way how it feel where in the like say you know one day do one before. So waiting like you answer to that, sir. Uncle Doctor, you have to unmute yourself. Yeah.
No, now, you see, I never ever say never in medicine, but I can guarantee you, Mama, at 68, I'm very doubtful of woman will go born twin them for that matter. For one, twin pregnancy is a very high risk pregnancy. At the age of 68, the muscle they're all, remember we talk about Kegel exercises, way down below, clearly the muscle they don't all the week. There's no possibility for let you carry two picking them, you know, triplets or twins or whatever, for that 9 months, you understand? And no expect for leg cesarean section. So there's a few questions I want to ask, you understand? I don't tell you, say, I want to tell you, I say, there was a time when we get one pastor, we they tell you, say, woman that can born live at 68 and all that. What they do, they go take people and begin abduct them. Within them can begin tell you all kinds of jazz and tell you, say, yes, you go born. And the next thing you realize, he tells you 90s, like picking this way, don't born. You know, there's a lot of fantasies, but at 68, I tell you what, if at the age of 40 to 58, this woman not for born, but then he born at 68. Well, I tell you what, I know they say no, but I'm very, very, very reluctant to accept, say, this is what it is. I tell you that for free, number. I do not think so. Are you with me? I'm not saying that they happen, no. And then like you say miracle they happen. We in science, we always welcome them kind anecdotal happenings, you know, anecdotal in the way they happen. But I'll be honest with you, the likelihood of a 68-year-old carrying twins to full pregnancy or even conceiving at 68 is very unlikely. Very, I don't even know how to put that to you. Would that be the second question, please?
The second question that at this stage now, they find difficult, like say that the first and they get my papa business with him, man.
Oh, after how long?
Well, given the stage you say they now, you know, now that experience they get.
Say,
you know, they go through.
Not they feel nothing for the man.
No, not to say they feel nothing, but when they do them, you know, it's like not the first time they do them. Anytime we do them, it's not the first time they do them.
Yeah, that's it. That you just proved me point. I'm glad I know one call but it just proved me point. Say, in fact, it just go against within the question we asked number one. We say this woman conceive because the hormone that women they keep this thing up, they keep them fresh. In fact, I tell you one thing, women then they get more of the infection them after menopause than pre-menopause. At the menopause, before the menopause, women then they absolutely they high up. That particular private part we got with them is so clean as it were, apart from that monthly thing where they happen. But it's so they take care of himself that with the hormone then they do a lot. Then they increase the immune system. They increase the immune response clearly. But the fact of the matter is, as the menopause come in number 9, that it begin dry, and when it dry, it cause pain. Now they call dyspareunia. You understand? That dryness there, as I'm talking no more. And that they cause pain, and that they cause problem, the tightness, and then of course it lead to one thing or the other, dissatisfaction, problems. But if they use the gels and other things, then the balm, the way they give clearly, and of course, if it's possible, in other contraindication for use the HRT, the hormone replacement therapy, clearly, you know, you can use them and that can help for prolong that period.
Okay. I hope so that answer your question. Now, I want to ask now, no go the other way now. Family, I hope so now will forgive me because, you know, as soon as I go see you, I kind of young in a way. But I want to ask, what about cases where people don't reach that stage there for some reason, the woman then become very, very active, even active than when they be younger? Is it possible? And why?
Absolutely. But that's not above average. As I've been talking no more. You get below average, you get above average, and you get average. Now, obviously, as I say, just about 4 days ago, one mommy come on television and talk, say, I don't know if this is normal, or say, make I ask you no more. He say, at the age of 75, every morning I wake, I feel for a day with me, man. Is that normal? Now, your man told themselves and say, oh my God, who's you come on? You know what I mean? That nothing way not normal, but it's possible. Say the people in the day. As I say no more, in medicine, we never say never. We never they say this no go happen. It quite possible say that not just if you like, the term that if you like, a monkey user, not to say user, but a monkey say a freak kind of thing, you know, unusual. But normally, when they don't hang up, i.e. the hormones they don't dry up, the likelihood of that being natural is quite slim. But of course, you get the exception to the rule. And that's what happens perhaps in this case.
Okay, thank you very much. Anybody else there? We get another 5 minutes. So Sisiwugi, you want to use this opportunity for letting you whet people's appetite for your next session? I'll go unmute you. Add the time for unmute you. There we go.
Yeah.
Thank you very much, ma'am. I get 2 questions also for Doctor. One, somebody they ask, say, if we will do a session on waiting for expect after menopause. That's the first question. I'll get another one, but I will say answer that one first, and I will ask the next one. That guy will mute you. There we go.
Say it again.
You know, if we go get a session on waiting for expect after menopause, if you say that they need a whole session on as a tweaking cover now, we get roughly 3 minutes.
Waiting for expect?
Yes.
In what sense?
Well, that's what the question says. I think waiting possible don't go through menopause. Where the session where menopause don't waiting for expect. Is there anything special we get for happen?
Well, I mean, Tamara in session probably go.
Yeah, now that we can
Or
talk
now
about
you go deal with.
more the psychological side of things than it.
Yes.
When people talk about the medical side, there's not much more. Not just you go through the trend, as I say, the possibility of a heart attack when the woman they pre-menopause is definitely far less than when you're at menopause. At that time, cardiovascular diseases they catch up with the man them. It's as simple as that. They bone them, they become weaker, so they can for them and broke their hip or broke their hand. Because of the fracture the way they see now because of the bone getting weaker because of menopause. You understand? Again, the infection the way they get down below, mainly that because of menopause. You know, so the blood pressure goes up, the diabetes catches up, the skin becomes thinner, and then of course the infection will be a bit more delayed, if you see what I mean. You know, it will take a lot longer for heal, you know, for let the person well, you know, and then one thing leads to another. You know what I mean? So there's a lot waking happen, but just take and say now, the thing where the help woman will make woman then get longer life than the man. Then if you always watch at the lifespan, the woman then get a longer lifespan because of what you do in the years, the childbearing years, what they call them, that 10-week period they go on, then definitely get a lot more protection than we demanded. You understand? But by the time they catch up with we at that menopause, clearly it becomes equal, and some people are even more so than that. So it is what it is, and that's it. But if you want me to talk about the medical side, I can do that. But if you talk about the psychological side or maybe the mental health side, then by all means we can do that, no problem. But I need guidance as to which you want me to talk on.
Okay. There's the last question where it say how you go enhance libido during menopause.
Yeah, okay. I think we don't talk. We do on the slides as well. Then gel them, then cream them. You know, then pessary, ring pessary. You know, and even the HRTO they talk about. If it suits you, i.e., you not get the complications or the the contraindications for user, clearly not a problem. You can use that, and that can prolong the menopause for setting, and it can make them take a bit more of a backseat. You know what I mean? Because the longer it is, the better it is for you in terms of the time we need the experience. But the end of the day, as I say, you can talk to any chemist who can help you with that. But if you're really concerned, talk to your GP or your primary physician, then definitely get ways and means. Then go send you to even the sexual therapist. They can even send you to them, and there's always help around the corner. But one thing you know for do is shy away. That's all you don't want to do.
One last question, then we'll go wrap up. If girl picking begins seeing period early, then is there any indication for say they go go into menopause early as well?
Now that I've been touched on, that's a very good question. As I say, it is worrying. I think I remember somebody asked me about picking way now, but she was 5 or 6 where you begin see this blood they come up on. That is not a good sign. The need for investigate that. You know what I mean? A very then call menarche. That means the onset of period. Then so some picking them the age of 10, some picking them the age of 12. You know, then go get for begin see them period. Then so then they see one, they don't see again for the next 6 months, and then they see another one. Also Monday go see them now continuous. All that depends. But the hormones then they play wayo, i.e. up and down. Therefore, at that age they're not stable at all. You understand? That's quite different. As I say, I get 1 minute. The last day I see him, he been happy. When I go see him now, beginning of the year before the lockdown, I see them begin pull Bobby, and they say, "Oh my God, what is happening here?" You know, at the age of 10. But that goes to tell you, say, you don't they grow becoming a woman, and as long as you don't begin become a woman, that's what you expect. So the very first one where you get, and then called menarche, usually between the ages of 12 and 14. That's what it's been there. But now it will become a bit earlier. You understand? Now we know people that develop, then you get, development a bit earlier. So sometimes they 11 years, 10 years, then can actually begin to see that. You understand? But if you get some PQ at 6, 8 years old, clearly begin to see that clearly you need for investigator, because it's possible to say a hormonal problem where you get to deal it. And of course, as we be asked the question, at 68, if woman they get period, clearly, if you don't go into menopause already at the age of 50, 58, then at 60, 68, you begin get bleeding. Postmenopausal bleeding, not a good sign at all. You need a gynecologist for such amount.
Okay, but the bit, I don't know if that side I miss some. If they see an early, then they can miss it and can begin see that they can go into menopause early as well, or not we can just
as a rule perhaps, but it doesn't follow. No, not to TV na steadfast. Na rule way they say if you begin early for end early, may well happen like that. It does happen like that, but no mean say na steadfast na TV enshrined in law. Say if you begin early for end early. You know, there may well be some reason we make you begin early. And if that reason there, na sickness or something, then you for treat the sickness. No reason, no day for people say this thing not go end at in normal time. If you take care of the sickness, then clearly it go end at normal.
Okay. Thank you very much, Uncle Dr. Kamara. The panel, Cecile Gay, Mr. Ibrahim, and everybody else who don't join from around the world, now UK, you know, Middle East, America, Salon. Everywhere else, when I find myself at the world, and I thank you very, very much. Cecile Gay, I see you hand up, you want to join in, but please, okay, that's perfect. Okay, on all, thank you. May God bless you all. Now we done so for today. We'll go soon again in 2 weeks. So until we meet again, on a good night.
Thank you so much.
Good night.
Thank you.
Thank you.
Good night.